Waverley.
Thank you, Speaker. And it's great to see you in the chair this morning. I rise to speak on the Safe Patient Care, Nurse to Patient and Midwife to Patient Ratios Amendment Bill 2020, as do we all. And this bill will ensure safe and high quality care throughout our health system in Victoria in a range of clinical settings through improving minimum standards of nursing and midwifery staffing ratios. And this is crucial in order for us to properly consider and address the increasing patient complexity and changing models of care in our hospitals and maternal child health facilities. This bill also seeks to safeguard the already exceptional standards, I might add, of services in the maternal and child health area that our Victorians are provided, and protecting the minimum education requirements of those maternal and child health nurses. Now, there's a number of maternal and child health centres in my district of Mount Waverley. We have the Kerry Road, the Mount Waverley and the Pinewood Maternal and Child Health Centre. And they all do a fantastic job, and I'm sure everybody in the House would agree with me that all of our nurses, especially at this time for Victoria, have done an exemplary job in looking after us all who have needed it. And the local centre at Pinewood was actually the centre where two of my kids were assisted, were helped, our family was helped after they were born. So a special shout out for the Pinewood crew. I'd like to thank the Minister for Health and her team for their significant and important work, and her work obviously, in bringing this bill before the House. The government can already be proud of our work in ensuring access to high quality and safe healthcare. And once again, we see another piece of legislation that continues this very, very important work. But I'd also like to, to touch on a number of my colleagues' contributions. The member for Wendouree pointed out to us all that the Ballarat maternal and child deaths are turning 100 in 2023. So I hope they're going to have a party, and let's hope we're all around to see them there. That'd be great. But in more local news to us in Mount Waverley, my colleague from Ringwood, as he stated yesterday, has recently been celebrating the birth of his and his wife's first child, which I'm sure we all celebrate. Little Teddy he's a cracker. He's got good hair like his dad. And the best thing is that I can only presume, and I'm sure he'll correct me if I'm wrong, that we have another Hawks fan in Victoria, and that's good for all of us. That's a very good thing. So I've got to find a little teddy or a little jumper. We've got to get that done, because you have to get that done. I must admit, my third child, Sammy, when I rang Hawthorn membership to say, hey, look, we need to move our seats, and I said, oh, by the way, I'll need to add some membership next year because little Sammy's coming along. And they said, oh, don't worry about that, we'll do it now. So Sammy was a member before he was even born. Well, now, thank you for the interjection, Minister. We will move on. So we have to send our best wishes for the member for Burwood, the member for Euroa, and we've had a number of babies in the House. The member to my left there, obviously, has recently became a dad as well. So there is something in the water in Parliament, I think. Now, two acts will be amended by this bill, Acting Speaker, being the Safe Patient Care, Nurse to Patient and Midwife to Patient Ratios Act 2015 and the Child Wellbeing and Safety Act of 2005. And in 2015, the Andrews government enshrined nurse and midwife to patient staffing ratios into law. That was a very good day. An advancement that we are proud to have achieved. But it doesn't stop there. You don't just do something and just go, oh, well, that's done, and we'll walk away. We know that higher staffing numbers lead to a more engaged workforce, but also better patient care and outcomes. And isn't that really the most important thing? It is about the people who need the services when they need them. And so making sure that our nurses are fit and trained and relaxed and able to do their best is obviously better for the people who need them. And as we've seen throughout this coronavirus period of the state, they have done very well. So making that even that little bit better is good for us all. And I was delighted as a candidate in 2018 to be able to promise to the people of Mount Waverley that should we be voted back in, as the people obviously did, we would strengthen those ratios, and here we are today. So we've come full circle, and I'm sure that, and I wouldn't speak for the Minister obviously, but I'm sure that the work continues. And I know that this government will continue to work on the safety of patients. So now I do need to make a slight apology to one nurse in particular. So I hope you can indulge me, Acting Speaker. Around about 8 years ago, my appendix burst and it was a bit nasty. And I won't go into details because you don't need to know. But the end of the day was I was in hospital for about 30 days. And can I specifically thank all of the staff and nurses at the Monash Hospital and Jessie Mack. They were fantastic. But as I said, there is one nurse that I do need to apologise to. Now, I don't know her name, and I probably wouldn't name her even if I did, because that would be a bit cheeky. But suffice it to say, towards the end of the 30 days, I wasn't feeling great, and this particular nurse who was in charge of the area was on me quite regularly about getting up and walking around because I had to get moving again. Well, I didn't feel like doing that because I wasn't exactly too well. But she was on me, and she was doing her job. So suffice to say, I finally got up, a bit grumpy, and walked around, there I am. Got back to the area just near my room where she was, and I said, "You happy now?" and walked in. So I do apologise for being grumpy. I do. I shouldn't have been that way. But I'm pretty sure as I walked off, grumpy middle-aged bloke, into my room, she probably thought, "Yes, I am, thank you, now nick off." So I do apologise. Now, while I'm talking about Monash Health Centre, I've got a little bit of time left, I would like to extend your thoughts, Acting Speaker, to how not only our Minister for Health helps our patients, but also Victoria's big build and our level crossing removals help our patients. You might be thinking, well, that's a very long bow. How are you going to make this work? I will tell you. So, early last year, I had a meeting with the CEO of Monash Hospital, and we were talking about many things because that is our local hospital for the people in Mount Waverley. And so I said to him, "Look, Clayton Road level crossing's gone," which is fantastic, by the way. Thank you, Minister, for Transport Infrastructure. I said, is that a good thing? What do you think? And he looked at me, he said, "Well, put it this way. We don't deliver babies in ambulances anymore." So think of that. We have removed a level crossing. We've removed, I believe, 36 of them. But we've removed one particular one in Clayton Road near the Monash Hospital. And as a result, mothers who are in the process of about to deliver their child do not risk having to have that child delivered in an ambulance. They're making it to the hospital where they weren't before. That's a real benefit, tangible benefit of some of the work that this government has done over the last 5.5 years. And that work will continue. And I know that the Minister for Health, the Premier, the Deputy Premier, the whole Cabinet, Minister for Disability, Ageing and Caring is in front of me, and I know his work continues on a daily basis, and that work is very important. I commend the bill to the House.